Bismillahirrahmanirrahim. Quote of the day: if you cannot do great things, do small things in a great way. Today, I will be presenting substance abuse under the supervision of Professor Dr. Saira Afzal. Learning outlines, basic definitions, classification of psychoactive drugs, reasons for addiction, adverse effects of addiction, prevention and control of addiction, heroin addiction, treatment and rehab of addicts, recent advances in MCQs. Learning objective. At the end of the presentation, participants would be able to describe the terms related to substance abuse, criteria for addiction, classification of different psychoactive drugs, methods to control and prevent addiction, treatment and rehabilitation of the addicts. Definitions. Drug. The WHO defines a drug as any substance taken by a human being which modifies one or more body functions. Drug abuse, self-administration of a drug for non-medical reasons resulting in functional impairments and or social, physical, and emotional harm. Drug dependence. It is a state of interaction between a drug and a human body characterized by behavioral and other responses, which include a compulsion to take a drug periodically or on a continuous basis in order to experience its psychic effect or avoid discomfort in its absence. Drug addiction. State of or chronic intoxication detrimental to the individual and society produced by repeated intake of habit-forming drugs. To call a person a drug addict, following criteria must be fulfilled: psychological dependence, overpowering desire to take the drug and obtain it by any means to feel its pleasing effects; physical dependence, when the drug is withdrawn, the person shows withdrawal symptoms such as irrational and violent behavior; tolerance, tendency to increase the dose. Magnitude of the problem. Pakistan, it is difficult to access. About 6 million, 50% are heroin addicts. IV drug users are on the increase. Drug addicts are 80%. Highly intelligent, young, educated people are getting addicted. World. Alcohol, marijuana, heroin intravenous users are on the increase. Drug misuse. Taking the drug for medical purpose which is not appropriate, for example, taking aspirin for the pain of peptic ulcer. Classification of the psychoactive drugs: alcohol, opioids, heroin, morphine, and others; cannabinoids, churs, hashish, marijuana, ganja; sedative or hypnotic barbiturates, which are also called as sleeping pills; cocaine and amphetamine; caffeine and other stimulants, tea, coffee; hallucinogens, LSD; false perceptions, color, sound; tobacco; volatile solvents, glue, thinners, petrol; performance enhancing drugs, anabolic steroids, athletes. Reasons for addiction: peer pressure to alleviate stress, curiosity, experimentation, influence of the dramas, films, and advertisements; rebelliousness, pleasure's sake, disturbed home environment, ignorance regarding adverse effects, living away from home, unemployment, depression; theory of differential association. According to Sutherland, an act is learned from others during social interaction with them. So drug addiction is learned from addicts in the community life. Addiction-prone personality, easy and cheap availability to escape pain and discomfort. Adverse effects of addiction and dependence: socio-economic problems, unemployment, absenteeism from work, poverty and secondary poverty; marital tension, family disturbance, child abuse, crimes, and academic decline; poor personal hygiene. Psychological problems: depression, suicidal tendency, delusions, hallucinations, solitude, wide fluctuation of mood. Physical problems: poor health, weight loss, vitamin deficiencies, infections, IV drug users, hepatitis B, C, HIV/AIDS, direct toxic effects of drugs, alcohol on liver and CNS, poisoning due to adulteration, heroin does kidney damage, homemade alcohol, many deaths reported. Overdosage, heroin causes respiratory depression. Road traffic accidents, sexual problems, withdrawal symptoms, physical dependence, and heroids. Fetus, mental retardation, physically handicapped, low birth weight babies. Prevention and control of drug addiction. Primary prevention. Educational approach like creating general public awareness, Islamic laws, school syllabus. Legislation, stiff penalties for the drug cultivators, suppliers, manufacturers, and advertisement ban. Prevention at community and individual level. Having a good company, healthy activities, arranging walks, seminars. Use local leaders like teachers. Secondary prevention, which is identifying the drug addicts. How can we identify them? By those people which lose interest in daily activities, loss of appetite, loss of body weight, unsteady gait, clumsy movements, tremors, drowsiness, reddening and puffing of eyes, poor vision, slurred speech, nausea, vomit, body pain, fresh numerous injection marks on the body, acute anxiety, sudden mood change, depression, lethargy, passivity, emotional detachment, impaired memory and concentration, presence of needles, syringes, and stretched packets in home, academic decline. Detoxification, withdrawal from drug of addiction, gradual withdrawal in 2 to 3 weeks. Quick withdrawal to give medicines to treat withdrawal symptoms, for example, painkiller, antiemetics, tranquilizers, etc. Also give vitamins and balanced diet. In tertiary prevention, which is also known as rehabilitation, we prevent the relapse. How can we prevent the relapse? By changing the social environment, continuous supervision, vocational rehabilitation like provision of job, counseling which includes psychotherapy, positive psychotherapy highlighting the good effects of not taking the drug, negative psychotherapy highlighting the adverse effects if the drug is taken again. Phases of addiction: tolerance, habituation, and physical dependence. Tolerance. Tolerance is the diminishing effect of the same dose of the drug or the need to increase the size of the dose to get an effect similar to the earliest ones. Habituation is the emotional and psychological need felt for the drug. Dependence is the body's need to get the drug. This is the table showing dependence and tolerance of various drugs. It is shown, the medical use of various drugs is also shown in this table. Patterns of drug use: initial experimental use, casual or recreational use, dependent use, and drug addiction. Heroin addiction. In Pakistan, about 3 million people are heroin addicts, 50% of all the addicts. Characteristics: common drug of addiction in Pakistan. Method of taking: oral IV inhalation. It is increasing in rural areas and most dangerous. Effects: CNS depression, euphoria, drowsiness, analgesia, constriction of pupil, constipation, respiratory depression, psychological dependence, physical dependence, and tolerance. IV drug users: hepatitis B, C, HIV, AIDS. Decline in general physical health, weight loss, and vitamin deficiency. Characteristics of heroin addiction: toxicity due to impurities, kidney damage, overdosage, respiratory depression, and death. Withdrawal symptoms: after 12 hours of the last missed dose, intense craving, desire to take the drug. Pains, aches, sweating, flushing, shivering, piloerection, lacrimation, mydriasis, and vomiting. Diarrhea, abdominal cramps, tachycardia, hypertension, cold turkey posture, flexed back, arms, legs. Relapse rate very high. Prevention and control: again, the primary prevention, which includes the educational, legislational, community, and individual level. Secondary prevention: early diagnosis and prompt treatment, identifying the heroin addicts, withdrawal and support medicines, including detoxification. Quick withdrawal with the medicines requires hospitalization, duration of withdrawal 2 to 3 days. Give tranquilizers, Lexotanil, diazepam, painkiller, paracetamol, Diclofenac for diarrhea, Lomotil for vomit, Marathine. Cold turkey method: sudden withdrawal with no medicine. Do not use this method because it is painful.
दरवाजा खोल दो.
Prevention and control. Kindly unmute your mic. Prevention and control: gradual withdrawal, decrease the dose of the heroin slowly, 2 to 3 weeks. Tertiary prevention, rehabilitation, change of environment, change of job, city, etc., constant motivation and supervision. Heroin, due to its high purity, availability at low prices, and strong dependence quality, its abuse has taken an epidemic form. Unlike opium and cannabis, which were abused by a certain class of people, the heroin abuse has spread in all classes of the population. Treatment of addiction, hospital treatment, any therapeutic treatment is effective if the addict voluntarily submits to treatment, his family cooperates, and there's a foolproof system of vigilance over the patient to ensure he is not supplied with the drug. Psychiatric treatment, efforts should be made to remove mental worries of the patient. Contacts of the addicts with the social and antisocial associates should be stopped. Introduction to religious education, and he should be informed about the adverse effects of addiction and his risk of going to jail for his criminal acts. Preventive measures by government and NGOs against addiction. Cultivation of drug plants should be licensed. Anti-Narcotics Mass Media Foundation has been set up with headquarters at Islamabad to initiate programs for drug abuse prevention. Smuggling and illicit trafficking of drugs should be effectively checked. Legislation for dealing with the offenders. Rehabilitation of hippies should be undertaken in the country of their choice. Establishment of FCI to collect the data regarding addict population, nature of drugs used in the country. Unemployment problems should be solved. There should be well integrated data with the public health institution as a part of their educational curriculum against the drug addiction. Rehabilitation of the addicts, setting up a welfare home in a well-protected building outside the city for the rehab of the addicts. There should be adequate arrangements for supervision and control over the addicts. The welfare home should have the following units: assistant unit consisting of a psychologist, a doctor, and a social worker, occupational and vocational training unit, medical and psychotherapy unit, educational and recreational unit, and in the end, management unit. Recent updates. We know what can needs to be done to help reduce the burden of the psychoactive substance use. Therefore, WHO is committed to assisting countries in development organization, monitoring and evaluation of treatment and other services. The harmful use of alcohol results in 3.3 million deaths each year. On average, every person in the world aged 15 years or older drinks 6.2 liters of pure alcohol per year. Less than half the population actually drinks alcohol. This means that those who do not drink consume on average who do drink consume on average 17 liters of pure alcohol annually. At least 15.3 million persons have drug use disorders. Injecting drug use reported in 148 countries, of which 120 reported HIV infection among this population. Stress and substance abuse among the workers during the COVID-19 pandemic in an intensive care unit, a cross-sectional study. In this article, we found that the association between the symptoms of traumatic stress disorder, substance abuse, and personal occupational characteristics of Brazilian COVID-19 ICU workers is still to be addressed. And in the results, direct exposure to patients infected by COVID-19, history of relatives infected by COVID-19, and sex were significantly associated with signs and symptoms of traumatic stress disorders. 76.5% of the participants had scores compatible with a diagnosis of traumatic stress disorders. Conclusion: ICU workers had significantly elevated scores on both screening forms. Providing psychosocial support to ICU professionals may prevent future problems with traumatic stress disorders or substance abuse. Treatments, perceived stigma, and employment outcomes among substance abusers in China. Employment is a vital component of a substance abuser's recovery, but little is known about how stigma affects employment for substance abusers receiving treatment. The current study investigates the effects of stigma and treatment on employment in the Chinese context. Using a sample of the substance abuser, multiple logistics regressions with moderation effects were employed. The findings show that treatment positively reduced confirmative experiences of anticipated stigma and promote employment only when respondents do not perceive the stigma. The findings highlight the impact of perceived stigma on limiting substance abusers' chance of being employed, implying that eliminating stigma is the foundation for recovery. Now we move on to the MCQs. A person is taking sleeping pills regularly for a month. For him to be labeled as an addict, which of the following criteria must be fulfilled? A, dependence and habituation. B, dependence and tolerance. C, physical dependence and abuse. D, physical dependence and psychological dependence. E, physical dependence, psychological dependence, and tolerance.
E.
E.
Yes, E is the right answer. Substances that alter mood, thought processes, or that are used to manage neuropsychological illnesses or behaviors are referred to as anabolic steroids, psychoactive drugs, ergogenic acids, designer drugs, beta blockers.
B.
Beta.
Yes, B is the right answer. People using ADHD medicines like Ritalin to lose weight or increase their focus during late night study sessions. This is an example of drug abuse, drug use, drug misuse, drug dependence, and drug addiction.
C.
Charlie.
C is the right answer.
C.
Drug addiction is learned from addicts in community life. Like a contagious disease, the drug habit spreads from a man to man and a woman to woman. This process is called theory of drug rate, theory of drug reception, theory of differential association, psychological theory, or psychoanalytical theory.
Psychological theory.
No, it's called theory of differential association, C. Narcotics like opium, heroin, morphine, codeine, which belong to the psychoactive drugs, are also used medically for A, anesthesia, B, antisepsis pneumonia, C, necrolepsy, D, behavioral disorders, E, relief of pain.
A. Anesthesia.
No, it's E, relief of pain. E, relief of pain is the right answer. The abrupt cessation of a substance dependence and the resulting unpleasant experience, as opposed to gradually easing the process through reduction over time, is called A, withdrawal syndrome, B, cold turkey method, C, hot turkey method, D, syndrome of inappropriate drug use, E, drug abuse.
B. Cold turkey method.
A.
B is the right answer.
B. Cold turkey method.
Yes, B is the right answer. LSD starts to take effect around 30 to 90 minutes after taking it that individual experiences A, delusions, B, depression, C, euphoria, D, hallucinations, E, decreased heart rate. D, hallucination. D is the right answer. D is the right answer. Local community drug prevention streams include which of the following measures? A, arranging walks and seminars, B, identifying the addicts, C, detoxification, D, rehab, E, supervision.
Rehab.
No, A is the right answer, arranging walks and seminars. In substance abuse, the term self-medication for non-medical reasons refers to A, doctor prescribing their own drug, B, drug abuse, C, drug dependence, D, motive for using a substance, E, deciding the drug of choice.
C.
No, it's B, drug abuse. Detoxification is a process of systematic and supervised withdrawal from substance use that is either managed in a residential setting or an outpatient basis. Medicine given during detoxification can help with A, help reduce withdrawal symptoms quickly, to prevent relapse, to prevent tolerance, D, to prevent dependence, E, to prevent addiction.
B.
No, it's A. Medicines given during detoxification can help reduce withdrawal symptoms quickly. This is the key of our MCQs. Thank you. And kindly
Thank you very much. Okay, thank you very much. And also subscribe the YouTube channel for having these lectures to be listened again and to learn more. Thank you very much, Dr. Alishba. Very nice presentation. The most important part is about the rehabilitation. We know that the drug addiction needs rehabilitation, and that consists of three important pillars. One is the physical rehabilitation, so that the physical dependence is decreased. The second is the psychological rehabilitation, so that the craving and they are trying hard to get the substance that is used for abuse, that is decreased. And the third important part is the occupational rehabilitation. All those people who are not doing any work or are unemployed, they must be given some work so that they can use their energies in a positive way. As we know that in a contemporary world, the most serious problem is about the drug addiction in the youth and adolescent. And as the societies, they are struggling very hard. We know that there is very little success in decreasing the substance abuse. And as in Pakistan, over-the-counter drugs are easily available, and many people can get the drug without the prescription from the general physician or from the registered medical practitioner. So that increases the chances of abuse from those drugs that are not opium, heroin, poppy, or other things, but they are some intoxicating drugs. And recently we have also heard about ice, that is amphetamines, and increased the prevalence of use among the adolescents and youth, especially belonging to the upper middle class and upper class. So these people who are not only harming themselves, but they are also causing damage to their family, their economics, finances, and their socio-cultural norms. So the more drug rehabilitation centers can improve the rehabilitation of all these addicts, and the single model that must be used are consisted of the treatment block, the vocational skills where the certain skills are being taught the people so that they don't waste their time and energies. And another important thing is that their capacity to increase work without doing any drug, that is the most important part. The facilities has to be increased because we know, according to the latest data, the registered drug abusers are about 70 lakh, and it is a big number. And I'm very much sure that these are very less. It is just the tip of the iceberg, and actual number are much more than those registered abusers. And it should be near 1 crore. So the rehabilitation phase needs to be a strong, regular system where the people, they can be restored to their normal activity, especially their young and youth uh, can be preserved, and they can even earn certain salaries, wages, or some life earning things by having some skills in their hand. The most important part that I have witnessed over the years is that unemployment has increased exponentially, and that is causing more and more of the people to be frustrated, and they are not able to get all those things that are required as a basic necessity of life. So the relapse is another important thing that has to be prevented. We know that not only the government, it is also the important part of each and every person, organization, especially the non-governmental organization, to support, guide, and provide these skills for the prevention, reduction, and overcoming the hurdles that are required for the substance abuse. My next important thing that I always promote whenever I'm the part of the policy making is to increase the mental health recovery of these patients by improving certain important things in our socio-economical context. Whenever we are
Jay,
following examples of the others, and
Dr. Munsa,
Dr.
please mute your mic.
Alishba and Dr. Amna, would you please mute your mics?
Ma'am,
Dr. Amna, please mute your mic.
एक मिनट पापा.
Dr. Amna, please mute your mic. So we were discussing the important policies that can be used in order to decrease the effects of the substance abuse. And one of the most important is rehabilitation center. The second most important is the decreasing the unemployment. And third important is by giving certain skill sets to our youth. Without these important interventions, no policy can be effective. Nothing can be done and we would still having the increased number of the substance abusers in our society. So we can't follow any model blindly. We have to make the models in our own local socio-cultural context, especially in Pakistan. So these are few of my advice for the group. Thank you very much. And very well done, Dr. Lishbak. You have beautifully covered important aspects. However, I would like you to please also include the 3 important pillars in rehabilitation of the drug abuse and the policies that are recently being launched to improve the to decrease the prevalence of substance abuse and improve the condition of the substance users. So please also include all these things. Thank you very much. Allah Hafiz.
Allah Hafiz, ma'am. I will include all the new things that you have told.
Thank you. Allah Hafiz.